Hello, thank you for visiting Children's Emergency at KK Women's and Children's Hospital. Your child has had a cut, which your doctor has assessed to require stitches or sutures. We have put together this video to help you understand more about how to care for your child's wound after it's been sutured. In this video, we'll talk about suture types, how to care for the sutured wound at home, when you need to come back for any follow-up appointments, and when you should seek medical assistance. In general, there are two suture types: absorbable and non-absorbable sutures. Absorbable sutures will usually fall off about 7 to 10 days as the wound begins to heal. There is no need to visit a doctor or to use any instruments to remove them. Non-absorbable sutures will require a follow-up appointment to remove them. Depending on the wound site and characteristics, your doctor will use absorbable, non-absorbable, or even a combination of both suture types. There are 3 aspects to looking after your child's wound at home: wound and dressing care, medications, and activity limitations. For wounds on limbs, after closure of the wound, your doctor will apply a dressing to protect the wound. Do not remove this dressing until your follow-up appointment unless advised otherwise. This dressing should be kept clean and dry. You may wish to use a plastic bag to cover the wound during showers to avoid soaking the dressing. If the dressing becomes wet, stained, or comes apart, visit your local polyclinic or general practitioner to change the dressing. Your child may need some simple pain relief, such as paracetamol, in the first couple of days following an injury. Your doctor may also prescribe antibiotics to prevent infection of the wound. Complete the course of oral antibiotics as prescribed. Ensure that your child rests and avoid moving the area to prevent the wound from bleeding again. Avoid swimming and other activities which may injure the sutured area. For some wounds, your doctor may have to put your child on a cast to prevent weight bearing, especially for certain injuries involving the legs and feet. Your child may require follow-up appointments to ensure that the wound is healing well without any infection, and also for removal of sutures. In general, the wound is reviewed approximately 7 days after repair. Subsequently, the stitches are usually removed around 14 days after the repair. Your doctor will advise on the timing of these reviews, and if you should consult your general practitioner, polyclinic, or one of our specialists at KKH. You should seek medical attention if you notice your child has any of the following symptoms: a fever of 38 degrees or more, if the wound splits or gapes open, if the skin around the wound is red and swollen, if your child has severe pain not relieved by the prescribed pain medications, or if your child has any prolonged or abnormal symptoms which cause you concern. Key points to remember are: after closure of your child's wound, your doctor will apply a dressing to protect the area. Keep this dressing clean and dry. Do not remove this dressing until your follow-up appointment unless otherwise advised. Visit your general practitioner or the Musculoskeletal Center at KKH for wound review and suture removal as advised by your doctor. Bring your child to a doctor if you notice your child has any of the warning signs explained earlier. We hope you feel more confident in looking after your child's wound after watching this video. Do also refer to the pamphlet given for further details.